Hello, I'm called Namsoke Rose, a midwife from Guru Regional Referral Hospital. Today I'm going to talk about intranatal care. I started with intranatal care, the roles of a midwife. Now I'll talk about the complications that are likely or always occur during the time of childbirth or intranatal period. Through good assessment, observations, these complications may not occur. And some of these complications are, we have bleeding during the period of childbirth. This always, in most cases, comes about with these mothers who come late. Labor starts from home and a mother reaches the hospital after 6 hours. During that time from home, nobody has checked you. Then you come from in the hospital. Sometimes when it is late, though you've come, we have to act. That is all time of intranatal period, which could have started from hospital, but this bleeding always happens with mothers who come from home, or it can also happen from hospital with mothers always keep quiet with their complaints when they don't want to give straight history to the medics. The mother could have fought with the husband and was kicked. That kicking alone can induce labor. And you don't know whether after kicking, the kicking would have separated the uterus from its attachment. That is number one. We have prolonged labor. Prolonged labor always come in with mothers who don't want to keep emptying their bladders. We always tell you to empty your bladders. There are reasons. A bladder is in front of the uterus and the rectum is behind. So when a bladder is full, it blocks the way for the passenger. The baby won't come out fast. In this, it will prolong the hours that you would give birth. Then, complication number 3, we have fetal distress. Fetal distress also can come about after when the labor is prolonged. We expect also the baby to get tired. The baby will get tired if it has failed to come out in time. I told you, you have to keep passing the urine, but if you don't, that's why we always put a catheter to drain off the urine such that you can produce in time, you give birth in time. So during that time, if it's not done in time, the baby also gets tired and we get fetal distress. That is the complication number 3. Then we have maternal distress. Maternal distress is when a mother is exhausted. A mother cannot do anything during labor, cannot push, is just there. That is why we always say to take sweetened tea. This tea helps you to get energy or to become strong. Remember, our body is made up of muscles. The uterus has muscles. It is supposed to push your baby downwards. Yourself, in the process of pushing, you have the muscles, the abdominal muscles, they help you in pushing. So if you don't take this sweetened tea to get energy, to become strong, you fail to push, and even these muscles won't have enough glucose to help you push the baby. Then complication number 3, we have ruptured uterus. That is a fetal one. It can lead to death very fast. This comes about with the mothers. We have types of mothers. Number 1, under this ruptured uterus, mothers who have previous scars. Your precious mothers or your mothers who are at risk. Don't always labor from home. If you have a previous scar, you're a mother whose uterus can rupture at any time. And we have those ones who have previous scars, who want always to labor from home, come in the hospital late. All those ones who have previous, when they are fresh scars, you've conceived after 1 year when they did a Caesar. An example I can give on this: get a cloth that is elastic, tie it somewhere and sew it with a needle. Then pull that side where you've sewn and see whether it will come properly. It will give away where you put the threads, will give away, will tear. Then also pull this side which is elastic and see how it is. That is how the uterus is. A scar tissue is never elastic. It will always give away. Then you get a ruptured uterus, you lose your life, even the baby will die. So that is also there. 2, under the ruptured uterus, we have mothers who take local herbs. These herbs have oxytocin. That is why you take them. From the hospital, we give oxytocin in small bits and small amounts until we reach a level when the mother's got good contractions. Then we reduce and we give it in bits. But as for you mothers, with their caretakers, you take a huge amount of it with the herbs, and even you can keep adding. This will cause excessive contractions without giving the uterus time to rest. The baby will become also distressed here, will get tired, because during that time the uterus is supposed to contract, releases. Then it gives time for the baby to breathe through the placental bed. So the contractions will be severe, baby won't get time to breathe, then will become distressed, will get tired. 2, these excessive contractions will thin out your uterus to like a thin cloth. Then the next step is the uterus to give away, to rupture. So mothers, please avoid all this and reach hospital early for close observations.